Good morning, good people. It is wonderful to be here with all of you again this morning as we celebrate some extraordinary leaders here in our community. This month recognizes the importance of public health and specifically National Public Health Week. About 2 weeks ago, it was announced that once again Montgomery County was one of the healthiest counties in the state of Maryland and one of the healthiest counties in the entire United States of America. And although they no longer do rankings officially, we're number one. So, and we are number one, quite frankly, because of the extraordinarily public health infrastructure that we have here in our community. The synergy between our public, private, and nonprofit sectors is critical to ensuring the health of our public. And let's be honest, there is nothing more important than the health of our public. It takes all of us supporting each other, but especially our public health professionals who dedicate their lives every day to making sure all of us are healthy, and especially our most vulnerable populations. This was never more important, as we know, and we will never forget during COVID, when our public health officials risked their own lives every day to be able to administer health to all of us, but also were the subject of threats on social media that were nasty and awful and frankly scary. But despite all of that, we have overcome these challenges and are now in a position that I believe we can build off of. And we recognize that somebody's health in Poolesville should matter to somebody who lives in Wheaton. Somebody's health in Bethesda should matter to somebody who lives in Germantown and vice versa. So we must continue to move forward. We must continue to invest. We must continue to recruit the best and brightest into this extraordinarily important field. Joining me today are some extraordinary individuals, several of which you will hear from soon. But we have our incredible public health team from the Department of Health and Human Services, led by Dr. James Bridgers, Dr. Keisha Davis, Dr. Nina Ashford, Dr. Chris Rogers, and Mr. Sean O'Donnell. We also have public health partners and leaders here. Ms. Anise Cody from the Holy Cross Hospital in Nexus, Montgomery. And I was born at Holy Cross Hospital, class of 1976. Dr. Elliott is here from the Mary Center, who is their CEO. We also have representatives from our minority health initiatives who are extraordinary partners in building bridges in our community every day to reach populations that the government cannot reach on its own. We have Dr. Pat Grant here from the African American Health Program, Ms. Hina Mehta from the Asian American Health Initiative, and we also have representatives from the Latino Health Initiative, Ms. Patricia Rios and Ms. Marcela Campoli. And shout out to the African American Health Program, who celebrated the anniversary of their wonderful health day that they did in Germantown just this past weekend. Another very successful event and another wonderful example of the importance of providing health directly in our community. We also have from our Commission on Health, Ms. Gabriela Limos, and from the Department of Environmental Protection, Mr. John Monger, because we recognize that public health in all policies is what we need to ensure that we administer moving forward. And our environmental health is very critical to all of us. We also have representatives from Montgomery Cares Health Clinic Leadership, Mr. Mark Forker from Mercy Health, Kate Liu from the Pan Asian Volunteer Clinic, and Mr. Peter Lowett from Mobile Med. I see these folks in meetings all the time. I see them on weekends and evenings and holidays, and I am so proud to stand alongside them this morning. We will now hear from two important speakers from our Department of Health and Human Services, and we will start with Dr. Keisha Davis, our County Health Officer. Dr. Davis.
Thank you. Thank you. Good morning, everybody. Happy National Public Health Week. We are so excited to be here. Thank you for the recognition. I want to thank again the team, the public health team, and also recognize Kenny Welsh, who is our Senior Administrator for Licensing and Regulatory Services. Public health serves in the background, to make sure that we are creating healthier communities for all. Montgomery County gets to have that distinction of being the healthiest in the state and one of the healthiest in the country because of the work of public health officials working behind the scenes. We are data scientists, our epidemiologists who are running the numbers to know where the pockets of health disparities exist. Our licensing and regulatory team who is making sure that our food is safe to eat, our water is safe to drink, and our pools are safe to swim in. Our disease and epi team who is protecting us from infectious diseases like rabies and TB and Mpox and COVID. Our community health team who is conducting the community health needs assessment and putting the mobile health van into communities who need more access to health care. Our maternal and child health team who is making sure that we have more healthy moms and more babies seeing their first birthday. So we are here, we thank you for the recognition, and we thank the community for their involvement in helping to make this one of the healthiest communities in the country. Thank you.
Thank you so much, Dr. Davis. And on a cold, rainy day in November, Dr. Elliott, the CEO of the Mary Center, and I were passing out turkeys to families in our community. And I had the opportunity to really speak to him and really get to know him through that process. He's a shining example of somebody we are fortunate that could be doing anything, but has chosen this field and to support our community. And the Mary Center is also a shining example of the health clinics that we have in our community who are such strong partners and expand the reach of our public health infrastructure. Dr. Elliott?
Thank you, Councilmember Albornoz, and thank you, everybody, and definitely thank you to the colleagues and for everybody here today. You know, we have this privilege in National Public Health Week to recognize that health is more than just the clinical that we talk about every day. But it's important for me, just from the clinical side, to explain to you what it means to be a day in the life of a person that comes to a public health center. So when you think about pregnancy and maternal health, you think about what happens during the pandemic. So, for example, Mary Center, we had up to 80% of women at one of our sites had no health insurance. They couldn't go anywhere. So it was absolutely imperative that we were there, we were available. And in many situations, we never shut our doors, just like the members up here on this community. We never closed our doors. We were always present. And we had over like 250 women who had COVID that had to come to us during pregnancy because there was nowhere else to go. So these kind of impacts in terms of public health matter. It makes a difference. And when you think of public health, it's not just the clinical. They come and they encounter a patient care navigator. They encounter a family support worker. Are there any housing needs? Are there any community needs? Are there any issues whatsoever going on in your daily life that need to be addressed and accounted for and plugged in and collaborative with the county and other partners to make sure that we can support the community, because the health in the community also impacts our economy. So it is absolutely imperative that as we recognize National Public Health Week, we also recognize the massive impact it has on not just the individuals that come to our sites, but also on the entire community as a whole. So thank you.
Well said. Public health should not be a political issue, but it will be once again as we go through the national rhetoric of this presidential election cycle. But let's hold the line and continue to plant the flag here in Montgomery County, recognizing the importance of public health, not just this week, but every week. So I will now read the proclamation. Montgomery County Council proclamation, whereas the theme for National Public Health Week 2024 is protecting, connecting, and thriving. We are all public health, and the goal is to improve the health of all people and achieve health equity. And whereas Montgomery County continually ranks as one of the healthiest communities in Maryland and in the United States. And whereas the annual rankings report highlights the benefits of healthy behaviors, access to health care, high rates of physical activity, and social connectedness as protective factors in our community. And whereas in 2023, Healthy Montgomery Community Health Needs Assessment, a multi-year initiative aimed at shaping local health policies, directing healthcare planning, allocating resources, and facilitating collaboration across county government, community organizations, and health providers, identifies vital health needs that will improve health outcomes, disparities, and equity. And whereas the CHNA identified overall mental health as the most important health issue access to insurance as the most important social and environmental factor, and eating habits, low crime rates, and safe neighborhoods as the most important factors making us a healthy community. And whereas, when we all join together to address complex public health challenges across multiple sectors, we are ensuring a holistic approach to public health, addressing various determinants of health and promoting health equity for everyone. Now, therefore, be resolved that the County Council of Montgomery County, Maryland hereby proclaims April 1st to the 7th, 2024 as National Public Health Week. And be it further resolved that the County Council expresses gratitude to our public health workforce for their collective actions and commitment to ongoing collaboration and investment in the public health of all Montgomery County residents. Presented on this 9th day of April in the year 2024, signed by myself and our Council President Friedson. Thank you all again.